Hello, welcome to From the South. I'm Laura Prada from our Telesur studios in Caracas, Venezuela. We begin with our news. You stay with us. We begin in the Caribbean updating COVID-19 because we show you now a detailed image of how the numbers of COVID-19 are behaving in the region. Be in Trinidad and Tobago with 107, Jamaica, the worst hit, and Jamaica and Barbados with 63 cases each, and Cayman Island with 45. These four countries are the worst hit in the region. On your screens, you guys have the image of how our cases are behaving. In total, we have 541 confirmed cases, 38 deaths, and 67 recoveries overall in the entire Caribbean region. On your screens, as you can see, Trinidad and Tobago with 107, as we were saying, Jamaica and Barbados with 63 each, and of course, Cayman Island with 45. Also in the Caribbean, in Puerto Rico, this Thursday, the numbers increased to 40 related deaths. Previously, the Department of Health had announced that the figure stood at 33 deaths. The agency also informed that until now, the data will be updated every 24 hours and not in real time. The dashboard highlights that of the total of 3,386 hospitals beds for adults, 2,426 are already occupied, which leaves only 960 beds for future patients. Currently, there are 683 confirmed cases of people infected with the virus in Puerto Rico. And expectations grow also with OPEC Plus meeting, and they've said the proposed cut of 10 million barrels per day tentatively agreed after marathon talks would only happen with Mexico's, not the country, which is hell-bent on boosting production, reportedly backed of the idea. The body of world oil producers called on its members to contribute to the efforts aimed at stabilizing the oil market. On Thursday night, after marathon negotiations earlier in the day, stating that the 10 million barrels per day cut is conditional on assent from Mexico City. All this will be carrying on this Friday. In Venezuela, they have announced that almost 50% of confirmed COVID-19 patients have recovered in the country. Communication Minister Jorge Rodriguez said authorities reportedly only 4 new cases in the last 24 hours. Meanwhile, 84 people out of the country's 171 confirmed cases have been discharged from the hospitals after testing negative for the virus and showing no symptoms.
Almost 50% of all infected people has already recovered. And when we say recovered, it is not like in other countries such as Colombia, where they count them recovered even if they tell people to remain in their houses. 85% of the confirmed cases stay in their homes, and that increases infections inside families. These are the cases that are present in Colombia. Venezuela cares for its patients as we provide free medicine, and as I've said earlier, almost half all confirmed cases have already recovered.
Rodriguez also warned about the risks of imported cases due to the fast spread of the virus in Colombia.
At the moment, Colombia is considered to be the main source of infections for Venezuelans, due to the arrival of people from Colombia. We have established a control point in the locality of Ureña, and we are going to be much more cautious, much more strict and careful to find illegal crossings. We have seen a decrease in the transit of travelers from Europe, but in the case of Colombia, it was accelerated by the simple fact that this epidemic is not controlled over there in any ways. There is no proper record of cases, and that poses a risk for the strict control we are doing here in Venezuela.
In Brazil, the worst hit Latin American Caribbean country in the region wide by COVID-19, health authorities informed of the detection of the first case of the coronavirus among the Yanomami people, an Amazon indigenous group known for its remoteness and its vulnerability to foreign diseases. The Yanomami patient, a 15-year-old boy, is being treated in the intensive care unit at the hospital in Boa Vista, the capital of the northern state of Roraima, officials said. Brazil is home to an estimated 800,000 indigenous people from more than 300 ethnic groups.
Today, we had a confirmed case in the Yanomami, which concerns us a lot. This is a government concern for indigenous health.
Also, Health Minister Luis Enrique Mendieta called for a truce between authorities and that they should hold talks with drug gangs and militia groups in impoverished favela neighborhoods on how to contain the new coronavirus. Brazil is the country hardest hit, as we were saying, by the pandemic in Latin America and the Caribbean, and is bracing for potential devastation if big outbreaks erupt in its favelas, crowded neighborhoods that often lack basic sanitation and healthcare infrastructure. An estimated of 11.5 million Brazilians live in favelas, around 6% of the population. Brazil has confirmed nearly 16,000 coronavirus cases with 800 deaths so far.
There, we have to understand that these are areas that the state is often absent from, where drug trade and militia rules. How do we build this bridge in the name of life and health? Yes, dialogue with drug trade, with the militia, because they are also human beings and they also need to collaborate, help, participate.
In Ecuador, the city of Guayaquil is the hardest hit by the COVID-19, with more than 23,000 cases. The mayor, Tintia Viteri, who had previously claimed to have the disease, said on Thursday that she recovered and then left her house to visit a local hospital. She says she expects tens of thousands to die in the city in the coming months.
This hospital, thank God, hasn't been infected, and doctors here are making sure it stays that way. So my intention is to bring new equipment here, so pregnant women can come here, because they can't go to other hospitals, because they would be risking their lives, and the lives of the elderly, who are dying, one by one. If you watch the news, they are dying every day. This is a silent war. We see them die, but we don't hear gunshots.
And now to have more details of how it's going on, the COVID-19 spread in Ecuador, we have the following report from Denise Herrera. Welcome, Denise.
The Ecuadorian authorities have informed that Ecuador has 4,965 cases of this new coronavirus and 275 deaths. The government also announced new preventive measures to stop with the spread of this new COVID-19. They said that they will evaluate the restrictions of mobility in each province of the country. In this context are still the citizens from Guayaquil denouncing that they didn't receive any government help, and now the citizens from Montesinain are against the project of the new cemetery announced by the mayor of Guayaquil, Tintia Viteri. In this context, the citizens are denouncing that this project will affect them, will affect their territories, and they are still announcing that they didn't receive any help, any water, or any food. They are asking the authority to help them and to respect the territory. Also, the medical sector in Ecuador is affected by this new coronavirus. We should remember that doctors and nurses were denounced that they didn't receive any government help, that they didn't receive any medical support to face the sanitary crisis in the country. Meanwhile, the government said that they are receiving help from different sectors, from different countries, and for different international organizations. So they are taking all the actions and taking all the preventive measures to protect the citizens and the professionals.
Thank you, Denise. That was Denise Herrera from Ecuador. Like this, we go for a first break. Remember, follow us on Twitter at Telesur English and on my account at Laura Peters. We'll be right back. Back with our news, in the midst of the fight against COVID-19, the Cuban government has sent the 14th Health Professionals Brigade, 214 health professionals to brigade the 15th Brigade to join another team of doctors battling the virus in the African nation. The Cuban Medical Brigade will arrive in the African country with the participation of 188 doctors and 24 nursing graduates, plus other professional medical members. The solidarity from Havana is meant to support countries in situation of health crisis, meeting the priority needs in the country in question. It is worth noting that more than 400,000 experts have served in 164 countries to counter the spread of the pandemic. In Cuba, free medical care for all citizens have always been one of the pillars of the revolution. Let's take a closer look how this system is handling COVID-19 pandemic.
In these days, marked by the novel coronavirus, these images are exclusive to Cuba.
Good morning. We are medical students and we are doing a survey on the health of the population to see if they have symptoms.
Over 25,000 medical students visit Cuban homes to detect and prevent new cases of the pandemic.
People are grateful, not just because they are being cared for, but because they are being reassured that things are under control.
The ongoing search for possible infections is part of the island's healthcare system.
Have you had any respiratory symptom? Anyone from your household?
It has over 100,000 doctors as well as 9 specialists for every 1,000 residents. Since 1984, the development of a family care program has been an essential part of the system as well, providing one doctor to every community.
This framework is Cuba's greatest strength, something that was developed over many years and that has been improved over time with better training and resources. This allows thousands of med school students to make home visits.
Despite foreign pressure and shortages caused by the decades-old U.S. blockade, the island has guaranteed free healthcare to the entire population, while also helping other nations across the globe.
Over 50 years we have been providing help. Since 1963, over 450,000 health professionals across various generations have saved over 7 million lives.
Biotechnology is one of the best developed fields in Cuba, with close to 20,000 workers moving forward with many advancements, including the interferon alpha-2b, which has proven to be essential in the global fight against the novel coronavirus.
The Cuban interferon has been worked on for over 30 years. There is a lot of experience working with it for other illnesses. We know it helps patients build an immunity, and we believe it will continue to be essential to fight the coronavirus.
Doctors, not bombs. That is the message Cuba has long defended, and that has led to over 600 Cuban doctors to be deployed to more than 14 countries affected by the pandemic.
We are an army of white ones, willing to share our knowledge and save lives anywhere in the world.
Amidst a smear campaign aimed at the island's humanitarian program and a global pandemic that has put on display the fragility of developed nations' health system, Cuba is strengthening its system with solidarity and a guarantee of life over money.
We stay in the Caribbean. The Cayman Islands is now the 5th country in the world and 2nd in the Caribbean to report medical equipment being seized by the United States amid the COVID-19 pandemic. Barbados, Canada, Germany, and France have all had the same complaint.
The U.S. authorities actually removed from a vessel, a ship that was coming to Cayman, a container which contained 8 ventilators and 50,000 masks and various other bits and pieces which I don't have the details of. And so that has been a huge disappointment to us. All of those were things that were produced and purchased in the United States.
Jamaica's Prime Minister Andrew Holness has extended the nation's COVID-19 restrictions for the Easter holiday. The country's stay-at-home measures were expected to end on April 7th.
During the Easter weekend, the curfew will be from Friday the 10th of April 2020 through Monday the 13th of April 2020. The curfew will commence at 3 p.m. in the afternoon and end at 7 a.m. the next morning. In other words, the non-curfew hours, that is the period of time that you will be able to move about freely and conduct the essentials of life, would be from 7 a.m. to 3 p.m. daily over the Easter weekend.
The South African President Cyril Ramaphosa has announced an extension of the quarantine for 2 more weeks.
After careful consideration of the available evidence, the National Coronavirus Command Council has decided to extend the nationwide lockdown by a further 2 weeks beyond the initial 21 days. This means that most of the existing lockdown measures will remain in force until the end of April.
South Sudan has confirmed 3 cases of the novel coronavirus. The patients were identified in the city of Juba and Torid and are recently returned from COVID-19 infected countries.
A total of 65 contacts have been listed. The Ministry of Health Rapid Response Teams have collected 50 samples from the contacts of the 3 cases for testing. They are now tracing more contacts of all the confirmed cases.
The government of Jordan has announced a 48-hour round-the-clock curfew starting from midnight Thursday. The government first introduced a similar curfew on March 14 before easing it by giving people limited hours to shop for basic goods on foot. Last Friday, a full curfew was also imposed for 24 hours, and on Thursday, Health Minister Saad Jaber announced the death of 69-year-old man from COVID-19 alongside 14 new cases, bringing the total number of recorded infections to 372.
We reaffirmed the decision to impose a comprehensive curfew on Friday and Saturday, which will start from 12 midnight tonight and will last for 48 hours until 12 midnight Saturday.
One death was recorded at Prince Hassan Hospital for one of the infected cases, a 69-year-old. Allah bless his soul. He is a loss to all of us. Also, today there were 11 recoveries, 9 from Prince Hassan Hospital and 2 from King Abdullah University Hospital.
Saudi Arabia has announced a ceasefire in Yemen starting on Thursday. The UN called for a halt in hostilities amid concerns of the COVID-19 pandemic. This could pave the way for the first direct peace talks between the Saudi-led coalition and the Houthi rebels who have been at war for more than 5 years. The ceasefire will reportedly last 2 weeks and could be extended for all parties to discuss proposals, steps and mechanisms for a sustainable ceasefire in Yemen.
We find collisions, inconsistencies, and differences in the concept and details of this ceasefire initiative. One party says that it must be a comprehensive initiative and it won't be accepted by anyone. And another party says it is the limited initiative that is limited to 2 weeks as an urgent measure against coronavirus. So the scene is foggy, just as we are used to seeing from the UN and its envoy to Yemen.
Our position is clear and fair. We call for an end to the war, completely and permanently, and a lift on the blockade. What Saudi Arabia announced is not an announcement of a truce, it is an announcement of a continuation of war, because it uses its military, air, and naval forces to impose the blockade. The harm inflicted by the blockade on the Yemeni people is bigger than the harm of the war itself.
Time for another break, we'll be right back. In the United States, the economy has been hit severely by the novel coronavirus as millions of Americans have lost their jobs. The country has recorded more than 16 million layoffs over the past 3 weeks, and according to the Federal Reserve, the economy is in an emergency and is deteriorating with alarming speed. In many state authorities say their system cannot handle the massive increase of unemployment assistance requests. As of Thursday, there were more than 450,000 COVID-19 confirmed cases in the United States and about 16,000 deaths. In Italy, death toll as a result of the COVID-19 has risen to 610. This Thursday, however, more than 28,000 people have been recovered from the virus.
Today, unfortunately, there are 600 new deaths, while the total number of recovered patients stands at 28,470, which is 1,979 more than yesterday. 96,877 people are currently positive, with an increase of 1,615 more than yesterday. Of these, 3,605 are in intensive care. The decrease in the number of patients in intensive care and in treatment and hospitalization wards still needs to be underlined. The number of patients in the intensive care unit decreased today, compared to yesterday, by 88.
And over 16,000 people have died in France due to the COVID-19. The Director General of Health says the figure is spiking as more healthcare institutions are providing their data.
In the past 24 hours, 424 deaths have been registered in hospitals. We have recorded 4,166 deaths in nursing homes and medico-social institutions since the beginning of the epidemic. As I explained before, more and more establishments are sending us their data every day, which explains the increase in this figure. As you know, we had a technical incident at the National Public Health Agency yesterday. Therefore, the period covered is not 24 hours, but 48 hours. Since March 1st, if we add up the deaths in hospitals and health establishments, we have registered 12,210 deaths in France as a result of the epidemic.
And after over 2 months in quarantine, the Chinese government lifted the lockdown this April 8th on the city of Wuhan, where the novel coronavirus first emerged last December. We have more for you on the following story.
This is what Wuhan looked like a mere 2 months ago. And this is what Wuhan looks like now. The original epicenter of the COVID-19 pandemic, the city of 11 million is slowly living up after enforcing a strict quarantine to stop the virus.
Greetings from Wuhan. Today is day 76 of the quarantine, and most restrictions have been lifted. But there are still controls in place to protect the population. The city looks colorful, full of life, with joy. People are full of optimism.
Latin American and Caribbean youth who were there when the worst of the pandemic hit Wuhan were finally able to leave their homes.
During the quarantine, I stayed at home for around 65 days. On day 66, we found out that the community where we live was free of the pandemic. On April 5th, we received a certificate of health, which allows us access to certain places. That was an exciting day. At first, I was nervous, because you don't know if they took the right decision, but the feeling of freedom is extraordinary.
I miss the dynamics of the city, the movement, walking amongst other people. This is a safe city. You can enjoy your time here. You can see the Yangtze River, enjoy a cup of coffee. I miss all of that, but I think we will slowly recover it.
To exit Wuhan and to move around the city, everyone needs to present a green QR code that verifies their health. A mobile app was developed by the government that certifies that people are in perfect health.
When they want to exit the city, citizens need to show this code to prove they are in good health. If that is the case, their code is green. This app doesn't work for us foreigners at the moment, so we need to show a certificate of health.
The lockdown and the strict measures imposed by the Chinese government left vital lessons for the globe, lessons that need to be heeded now that the pandemic is ravaging the American continent and Europe.
Reading helped me get through this time, studying and occupational therapy as well. This was a fruitful time for my mental health. I was at the epicenter of all this, and I did not know what was going to happen. Nobody knew. Thankfully, I never feel ill, and I knew that if I followed the measures, I would get through the situation. This way of thinking helped a lot.
Our experience was intense, but it was also frustrating. We needed to learn many things, and now we need to transmit that knowledge to our nations, so they may follow the same road China paved to stop the virus.
Wuhan will be scarred by the experience for generations to come, and life in the city will never be the same as before. COVID-19 hit Wuhan particularly hard as the majority of China's 3,300 deaths happened there. But still, the city is rising back, showing the world that there is a light at the end of the dark tunnel.
Incredible story of solidarity and how a country can come together to overcome COVID-19. Like this, we come to the end of this brief. Of course, you can find this and much more other information on our website. The invitation is made. You continue with us with